FedEx employees, and welcome. I'm Sam, and I moderate these weekly webinars. In just a minute, we'll be joined by Patrick Ray, who's one of our senior advisors here, and he's going to be speaking to FedEx employees about the changes coming to Medicare in 2024 for retirees. Before Patrick comes on, though, I'd like to quickly remind you that although we work closely with both active and retired clients and potential clients of FedEx, the retirement group is not affiliated nor endorsed whatsoever by FedEx. We are a completely independent group of financial advisors here. After Patrick's presentation has ended, I will jump back on with him quickly to ask him some of the questions that have come through the Q&A box throughout his presentation. Please feel free to stick around if you'd like to listen for those. And if you happen to see a YouTube card popping up anywhere on your screen above my head here, and you'd like to click on those, please do. They will guide you to either a webinar that we've held in the past of a topic you might find of interest or concern, or even a link to book an appointment with Patrick after this webinar, or one of his colleagues if you wish. And with all of that boring stuff out of the way now, let's bring on our speaker, Patrick Ray. Hi, Patrick.
Thank you, Sam. Good afternoon, everyone. Hopefully everyone's having a great day. We appreciate you joining us today. And today I'm going to talk a little bit about the Medicare side of things. This is often a frequent discussion we have with respect to folks who are transitioning into retirement, or some of our folks who have left earlier than retirement eligible age from a Medicare perspective and now are planning for this particular process. And it is quite a process, so there's a lot to learn, and there's a lot of specifics that are helpful to have as an overview. So we're going to talk a little bit about the Part A and B references to Medicare that you may have heard of in the past. I want to talk a little bit about something referred to as IRMA limits and help you understand what that means, so that you can have that as a focal point, because that will be relevant to many of you listening and watching the presentation today. And then we're going to talk a little bit about our group and what benefits you might receive or get by having an organization like ours help you. And so first and foremost, there are two parts to Medicare, okay? And so for the most part, Part A is a free part of Medicare that everyone applies for and everyone gets, and it's the hospital side of Medicare per se. And what it basically covers is hospital stays and skilled nursing stays and hospice coverage and home health care coverage. And for the most part, this is a free service. And this is basically just a default to when you sign up for Medicare, you automatically get Part A. So what is different about everyone's Medicare going forward after Part A is the Part B side, which is the medical insurance part or aspect of Medicare. And that covers your doctor's visits and your outpatient care and preventative services and so forth. And there is a monthly premium requirement for that particular coverage. And so first and foremost, as a whole, for you to become eligible for Medicare, you have to be age 65. And it's very important to understand that regardless of your coverage from your previous employer or your current employer, assuming that you're 65 and still working, is that when you transition to age 65, Medicare becomes your primary health insurance, okay? And what you obtain by having Medicare is, for the most part, it's quite a significant reduction in premiums from the private healthcare insurance you might be accustomed to spending or covering for you and your family, as well as even if you're employed, some of the employer expenses, because a lot of those employers pass on the coverage to you. And while it might be less or expensive than an individual policy itself from the exchange, for example, you're still going to end up with a cost from your employer. And so often when you run into Medicare, you're going to find a reduction of what your overall expenditures are with respect to the premiums that you pay. And a lot of times you're going to find equal to or better benefits, as it turns out in the grand scheme of things, as far as what it covers and how it covers, and the periods of time that might have to go by before it covers certain things. And all of these things, for the most part, guarantees you a very large percentage of your overall needs to be covered. And so that's kind of unique, and it's certainly nice as you age and go through retirement, that one of the things that you don't have to concern yourself with is being able to qualify for or being eligible for Medicare, because it automatically happens when you're 65 years old. So just know, similar to Social Security, if some of you have already been through the Social Security process, that you want to start this period of getting enrolled and kind of doing some homework and so forth, maybe even prior to this 3-month window. But there's an enrollment period that starts 3 months prior to your 65th birthday, and that period ends 3 months after your 65th birthday. And so basically you've got 6 months to effectively get this thing honed in and dialed into what coverages would be best for you and your family to consider, and whether you should buy a Medicare supplement plan or a Medigap policy and all these other things, right? And so some of that is correlated to this next slide that we have with the difference between your health insurance at age 65 and beyond related to Medicare. So in other words, you heard me just reference the term Medigap before. And so Medigap is a jargon term, so you can understand that it basically is designed to pick up the deductibles and copays that Part A doesn't actually pay for. Okay, so you keep your Medicare policy, but you're allowed to choose your own doctors. This ends up typically costing you more money, but there are no co-payments, and the average cost is somewhere between 90 and 200 bucks a month. You don't have any referral needs to get from one specialist to another. And some routine services, unfortunately, are not covered, and usually those fall into the vision and hearing category. Typically, it's covered or you're covered anywhere in the United States. And it's effectively guaranteed renewal, which means regardless of your health history, you're eligible to participate and have a Medigap policy. And so your benefits effectively never change. But you could also consider something called a Medicare Advantage policy. And some of you work for companies that actually offer some supplement to help you offset the costs of your Medicare Advantage policies, or what they call Part C. And what happens is you basically you forfeit your original Medicare policy, and this is a complete replacement of your overall coverage. And it's restricted to in-network doctors. And so for this exchange, you have lower premiums that you can pay on a regular or ongoing basis. But sometimes there are copays that come into play. Typically, they end up anywhere from $0 and $100 a month, depending on the plan that you select. And in addition to that, some other caveats that you want to be understanding or aware of is that typically you need a referral for certain specialists that you have to go see. And that may actually include extra benefits like vision and hearing and ultimate fitness benefits and things that are not part of a normal Medicare plan or Medigap policy. But your possibilities are bigger, or they're more broad, if I would. And then as far as your Medicare Part C policy, you're talking about emergency services that are on an outside service area, so there's more coverage there for you to be able to enjoy, assuming you need it. And but the downside is that the benefits could change, and it could depend on what or company that you're using for your Medicare Advantage policy, and what changes they may have had throughout the year that they may implement the following year when you ultimately have a need for coverage, obviously, going forward for the rest of your life. And so that's something you want to be aware of. You may have heard of something referred to as IRMA limits. And so for the high income earners in the room, this is probably relevant to something you need to know, which is a Medicare caveat. And if you earn more than $206,000 as a married filing jointly household, that you're going to have additional premiums known as IRMA limits, which is referenced as the income related to your monthly adjustment amount. And so basically, this is a correlation to a trailing 2 years of income on how they rate what you have to pay for your Medicare Part B and Part D premiums. Okay, it's based off of this roll, and it's a rolling 24-month window from today. So, for example, if you were still working and now you're transitioning into retirement and you had a very successful and high-paying job, then it's going to impact what you pay, and you may end up paying more in the recent term of transitioning into retirement than you would 2 or 3 or 4 years from now if your income goes down. Or if you've made some big Roth conversions, for example, for those of you who are already retired and you're doing some tax efficient retirement planning, and you consider doing some Roth conversions. Of course, when you take money out of your IRAs to convert that to a Roth, you pay income tax on that. And that's part of this IRMA limit, which is related to this 2-year trailing window of how it works. And so here it is. We'll look at an example of a 65-year-old male and a 62-year-old female, as their income is a total of $180,000. So Bob's total health insurance premium is $309.20. He enrolls in this example, the original Medicare plan, and purchases the supplement plan G. By the way, those supplement plans are correlated from A through F. And the different parts of the different letters represent different coverages that you can ultimately get. And then you can attach a drug plan to that. So in this case, Part A is free. Part B for him is $174.70. The additional Medicare supplement policy is $127, and then the drug plan is $7.50 per month. And so in this case, Jane's total premium, which is purchased from the marketplace, and in her state-specific scenario, it costs them $1,200 a month for Jane's coverage because, as the reference was, she was 62, so she is not yet Medicare eligible. And so in total, this family is paying $1,504.60 for their coverage. And the way the IRMA limits would relate to what they end up paying for is in this spreadsheet that shows what your income was, of course, trailing back to 2022, right? So married filing jointly, we talked about 206,000 or less. So since their income was only $180,000 for that particular tax year, he's paying $174.70 for his Medicare. And then if you're filing individually or you're married but you file separate tax returns, that number is basically cut in half, so it goes up to 103,000. But you can see how the scale goes up for what you pay for your Medicare premiums, which are relevant to this IRMA limit on the column to the right. And the more income that you have, the more you can expect to pay, all the way up to the threshold of $594 per month. And so that's where those numbers in the previous slide had came up with respect to how we came up with those numbers with respect to what this family in this particular example is paying overall. Now, for 2024, there's been some changes and there's been some updates, which are normal, and this happens on an annual basis, where the average healthcare insurance premium for a 40-year-old on a silver plan for the most common tier purchase, as an example from the marketplace, would be $584, okay, per month. And that's a 4% increase from the previous year. So this is kind of to outline and help you understand the relationship of the increases that transpire each and every year. So you can see, like in the state of Oregon, it was a 17% increase. In Massachusetts, it was a 16% increase. In Alaska, it was a 15% increase. In Maine, it was a 15% increase. And in South Carolina, as an example, it was also a 15% increase. And so when we talked about the Medicare overall, the differences between Part A and Part B, Part A in 2024, the Medicare Part A costs are increasing by an overall average of 2%, which is an adjusted inflation amount, which is an increase in some years, but in this case, which is lower than last year's increase. And so what this looks like from last year to this year, when you talk from the differences between the calendar years of 2023 and 2024, is the inpatient hospital deductible has increased. In addition to the daily hospital coinsurance for the days 61 through 90 have also increased, as well as hospital coinsurance for lifetime reserves has increased on a relative basis, as well as the skilled nursing facility coinsurance from days 21 to days 100. So I'll stop here for just a second, because some of you may have or have heard of long-term care insurance, which is, as a side note, a individual private pay insurance policy that protects you if you need help with the daily activities of living, which is eating, bathing, dressing, toileting, transferring bed to a chair, and maintaining continence. So if you need help with 2 of those 6 things, you qualify for what would be the need for assistance. And if you have a long-term care policy, often those have deductibles between 30 and 90 days. And typically you could arrange your long-term care policy to coincide with your Medicare coverage, assuming that you're over the age of 65, of course, because there is a skilled nursing part to Medicare Part A that covers you for this first 21 to 100 days up to a certain daily amount, right? So in the end, the Medicare tax with respect to how much you're paying has not been a massive increase from 2023 to 2024. In retrospect, it's actually been a decrease. And more importantly, the thing that gets lost is the correlation to that trailing 2-year window from a IRMA perspective on what you ultimately pay for your overall coverage. Now, we did some homework in the past to try to help people with respect to this big picture of what a team might bring to you. And the reality is, if you're an independent person and you enjoy doing things on your own with respect to the research and the conclusions of what to do with your retirement assets and how to develop a tax plan and a risk management plan and an income plan and all these things, you might find that working with a partner in retirement is not for you. But for those of you who are interested in potentially working or partnering with a member of a firm who could help you, you might consider what an advisor in our shoes brings to the table. And some of these things are related to some coaching that we often go through with respect to how the markets are doing and how that correlates to your stock portfolio, as well as the construction of the risk management aspect of it and how to create an income plan and what's important to you and all the things that are built into what we do on a regular basis to help folks. And of course, there's an active management part to what this represents as far as what kind of advantageous things you might expect from dealing with a firm like ours in retirement. And in the end, the idea is that if you hadn't done any planning before, you should probably consider doing that. And so when we talk about these Medicare things and the differences between Part A and Part B and the Medigap scenarios and what may or may not apply to you, it also relates to Social Security when you're in the situation to try to concern yourself with when should you consider taking Social Security, and an analysis potentially that can help you understand the differences between taking it at 62 versus postponing it to 65 or 67 or even 70. This is one of many things that you'll gain, of course, from a partnership like ours. And so if you hadn't heard of the retirement group before, we've been in business for over a combined 150 years, and we have offices all across the country. And from a planning aspect, we know a ton of your Fortune 100 companies' respective 401k plans and pension plans and their medical benefits and how that correlates to you both while you're an active employee and when you're transitioning into retirement. And so in the end, the thing you might find the most value of is reaching out to us because we have an ability to produce you a complimentary cash flow analysis, which is an effective stress test of your overall financial and retirement well-being. And we're happy to spend some time with you in the event that you're open to having that discussion with us, because that's a service that we provide for you on a complimentary basis. So if you have some time and you hadn't already done that, or you haven't updated your plan in the most recent 12 months, you may want to consider reaching out to us in one of a couple of ways. You can email us at info@theretirementgroup.com. You can call our 800 number, which is 800-900-5867. You can take a picture of the QR code to the left, and that will get you access to calendars such as mine and the rest of my team members that can send aside some time in their calendar when it's convenient for you to spend some time with you to try to help either answer some specific questions that you may have or talk to you further about some things that might be important for you to learn or talk more about. And then if you're not already following us on LinkedIn, I would absolutely encourage you to do so. And we have company-specific pages on LinkedIn to help you put your arms around what's happening at the company from a retirement perspective for one of the prospective companies you may work with or you work for that we work with, that we've helped on many occasions in the past. And so if you hadn't already done that, I would encourage you to check that out. And you can scan that code on the screen to be able to do that. And then in the end, trying to make sure that we address as many questions as possible. And so what I would like to do is, before we let you go for the afternoon, because we try to keep these things as short as we possibly can, to give you relevant information for sure, so you can go on about your day, that I'll pass it back to Sam to see if we have any questions before we let you go. Sam?
Thank you, Patrick. Thank you for all of that information.
Sure.
If just as a reminder, before I ask these questions, those QR codes for LinkedIn and to book an appointment, you will also be redirected to our page where you can book an appointment with Patrick, one of his colleagues. You can take advantage of our complimentary cash flow analysis, all of the things that Patrick has already mentioned. So that you'll be redirected there after. But okay, Patrick, we're going to keep this short. This
All right.
first question. Can I continue to use my former employer's retiree health benefits alongside Medicare? And if so, how will this impact my overall healthcare costs?
Yeah, so this is a great question. The easy answer is you can, but you probably don't want to in most cases. And the reason is because of the expense. So there is a insurance term per se that's referred to as something that's called benefiting from insurance. Okay. So for example, if you're over the age of 65 and Medicare is your primary health insurance, you have the right, if you have the ability as a retiree from company X, to continue your healthcare coverage from that company. But if you fall and break your leg, okay, Medicare is probably going to pick up the majority of those costs. And so you can't have both policies pay for that same broken leg. And so the backup policy in this particular case wouldn't provide you much of any benefit because Medicare is going to pay and they won't accept the payment from your other coverage. meaning that they're not going to just stroke you a check for the difference, say, oh, well, since you broke your leg, you can put this in your bank account and help you offset the rest of your expenses, right? Because it pays for a broken leg. So what you might find value of is if Medicare applies to you, the differences between all the Medigap or different coverages that could plug in the holes that Medicare by itself does not cover. And oftentimes it's cost prohibitive to consider your old retirement plan version of healthcare from your companies in addition to Medicare as a backup plan.
Oh, got it. Okay. Thank you. Next one. How does Medicare coverage work if I plan to travel extensively or live abroad during retirement? That sounds nice. And what steps should I take to ensure that I have adequate healthcare coverage while away from home?
Oh, this is an easy one.
Okay.
Careful steps, extremely careful steps.
Okay.
Because Medicare is effectively useless when you step outside the US.
Oh, wow.
So for those of you who happen to have a position at a company, for example, that are doing some abroad traveling, I would encourage you to understand, if you hadn't already done so, through your benefits coordinator, what your plan does and doesn't cover, so that you have some reasonable expectation of an understanding if you're in, a different country. And so the rules from a Medicare perspective are very black and white, and unfortunately, they do very little to nothing for you in the event that you were anywhere else except for the US.
Got it. That's good to know. I didn't even think about that. Alrighty, this last one, Patrick. Are there any specific Medicare Advantage plans or supplemental insurance options tailored to retirees from large corporations that could provide more comprehensive coverage at an affordable cost?
Yeah, good question. Remember, Medicare is an effective government situation, right? A government plan. And so in the end, it's really irrelevant as to where or what company you worked for when you were working, when you transition into Medicare. And so what would be more important is just understanding all of the different intricacies of the Medicare supplement plans that are available and the different Medigap policies to ensure that those are tailored to your needs. And so instead of thinking of it as a plan that's tailored to company XYZ that you may have worked for, just think in terms of, based on the state that you live in, what's relevant to the options that you have and which one best represents not only what you can afford, but what provides you the most comprehensive coverage for all the scenarios that may come up. And so typically when you work with a Medicare related specialist, with respect to the coverage, then they often have all the answers to these questions. And so we're happy to help guide you through this process in the event that you're interested.
Alrighty, Patrick, that was
Yeah.
it. Is there anything else you wanted to add before we go?
No. I hope that you found some value in spending a few minutes with us this afternoon. And I think Sam and I have both mentioned that we try to keep these on a relatively short basis to get you some decent material to understand, and maybe just give you some food for thought on specific scenarios that we know come up on a pretty regular basis from our planning practice perspective. And so if you have those questions that we talked about, you can reach out to the office. But otherwise, hopefully you have a good day. Thank you very much for spending some time with us. We hope you found some value in our decisions and things that we talked about today, and we'll see you next time.
Definitely. Thank you so much, everybody, for watching, and thank you, Patrick, for your time.
All right. Thanks, Sam. Take care, everyone.